Welcome everyone to Pause to Listen, the Beattie Pet Hospital podcast. For those who don't know who I am, I'm your host, Allison. I am a vet assistant along with the one who runs our social medias. Before we get into the podcast today, I have a couple of announcements. So the first thing I want to talk about is something that we recently got in clinic care. It's called Glandex. A lot of you have probably seen it at your local pet stores or off of Amazon, but we are finally carrying it and it is so exciting. So this formula is balanced with fiber and other key ingredients to support a healthy digestive tract and help maintain healthy anal glands. So it does not contain any corn, soy, or wheat, which is great. And yeah, it is an anal gland supplement, and you are able to use it for cats or dogs. Just make sure you do read the label first and get the correct one. We do have two here in clinic. We have the Glandex powder, and we also have the chews. So if you are needing it, just come on in and we can definitely get that for you. So let's get into today's podcast. So today we are going to be talking about post-operative instructions. So post-op instructions are instructions that you will need to follow after surgery. Every surgery is different with the instructions. We will be going over feline and canine spays and neuters along with dentals. If your pet has just had surgery, please make sure you go over with your vet care team about the post-op instructions. First off, let's go over some general information about spays and neuters. After arriving home, you should keep your pet warm and comfortable by providing soft, clean bed, ideally in a quiet and draft-free room, at a comfortable temperature around 20 to 24 degrees. Your pet should stay away from any stairs unless they are supervised. We are not wanting them to run up or down the stairs so that the surgery site does not open up. Your pet should remain indoors overnight, going outside only for a short leash walk as needed to urinate or defecate. For most procedures, your pet's activity should be restricted for 1 week after surgery. It is essential to avoid running, jumping, and other strenuous activities that could cause excessive strain on the wounds. Your pet may return to normal activity after 10 to 14 days, unless your doctor has said otherwise. A couple hours after you get home, you may offer your pet approximately half of their regular dinner. Again, unless told otherwise. If they eat this and they still seem hungry, you may offer more food in small amounts about an hour after. Some pets experience nausea after general anesthesia. So, dividing a meal into smaller portions may decrease the risk of nausea and vomiting. Your pet's water should not be restricted. When your pet is home, they might be very sleepy. This is because your pet was given a general anesthetic. These drugs can take several hours to wear off and may cause your pet to appear drowsy for the day. Over the next 24 to 48 hours, your pet's behavior should gradually return to normal. However, if you do have concerns, do not hesitate to contact the hospital where the surgery was done. A common question we get is, why has my pet's foreleg been shaved? If your pet has a shaved area on their front leg, this is typically where the anesthetic or sedative was administered. Additionally, many dogs or cats receive fluids, also known as IV fluids, during surgery. The hair must be removed to allow that area to be adequately disinfected before inserting catheters. Sometimes this area will be bandaged. If so, you can remove the bandage when you get home, unless directed otherwise. Whenever we are performing surgery, your pet may have had a tube placed in the trachea, also commonly known as windpipe. This can occasionally cause a mild irritation and a slight cough. A mild post-surgical cough will typically diminish over the next few days. If coughing persists or worsens, contact the hospital that performed the surgery. Something that is super important and one of the main causes for surgery sites to open are licking and or chewing at the surgery site and stitches. Your pet may instinctively try to clean the surgical site by licking. If you have or been given a buster collar, also known as an e-collar or cone, please ensure it is used to prevent licking and chewing. If you have not been given one and your pet starts to lick or chew the incision, please contact the hospital and request one. If you have gotten a cone, please do not cut the cone. These cones are measured to make sure that your pet is unable to reach the site. If your pet ends up licking or chewing at the site, this can cause serious delay on the healing and results in infections, opening up, or injury. It is important that the collar is used, especially when the pet is unattended. Not surprisingly, many pets find these collars strange at first and will attempt to remove them. However, after a short period, most dogs will settle and tolerate wearing the collar. It is better to keep the collar on consistently rather than taking it on and off. It takes a few seconds of chewing for your pet to remove the sutures or to damage the surgery site. If your pet succeeds in removing any sutures, please contact the hospital as soon as possible. If you find your pet is having trouble eating, you are able to remove the collar until your pet has finished eating. But you must watch your pet to make sure that we are not licking or chewing at the site. Once your pet is done and you place the collar on again, ensure that you are able to fit 2 fingers comfortably between the collar and the pet's neck. This will ensure that the collar does not restrict the pet's ability to breathe or swallow. If you are unable to replace the collar properly, contact your veterinarian immediately. If your pet has been hating the cone and will not settle after a couple of hours, options other than the traditional plastic cone includes donut-shaped collars or surgical suits. If you are interested in one of these, make sure you talk to your veterinary beforehand. Surgical suits can sometimes interfere with the healing process. Even with a surgical suit, most pets will lick the fabric over the site. This can lead to moisture seeping through the fabric and causing the surgical site to get infected. Something that should be done daily is taking a look at the incision. The incision should be generally clean and the edges should be together. The skin surrounding the incision should be a normal or a slightly reddish pink color. In pale-skinned dogs, bruising is often seen around the surgical site. This may not appear until a few days after the operation, and in some cases can seem excessive compared to the size of the incision. This is due to seepage of blood under the skin's edges and is a normal occurrence. If you are concerned, contact the hospital immediately, along with if you see any continuous or excessive blood draining, excessive swelling or redness of the skin, or an unpleasant odor or discharge, contact your vet immediately. For most skin sutures, they are generally removed 10 to 14 days after the operation. The actual time depends on the type of surgery performed. You will be instructed if and when your dog should return for a suture removal. In some cases, your vet may use sutures that do not require removal. These sutures are placed under the pet's skin and will dissolve in the next coming weeks. Contact your vet if you have any questions regarding your pet's stitches. It is also essential to avoid swimming or baths for a month or more after your pet has had surgery. Moisture can help introduce bacteria into the wound and lead to infection. Your veterinarian will give you detailed instructions on activity restrictions. After surgery, your pet may be sent home with pain or oral medications. If you have been given any medication to give your pet, please read the label carefully and ensure that you are administering all medication as instructed. Great. Now that general information for spays and neuters are done, we can talk about another common surgery that happens, which are dentals. For dental surgery, the post-op instructions can change a bit due to how many teeth may have been extracted. For the majority of dentals, you will want to feed soft foods, which are either canned or softened kibble, for the next 2 weeks. This can be longer due to the number of extractions. There may be blood in the saliva or in the water bowl for the next week. Try to prevent your pet from pawing at their mouth. If we are pawing at the mouth, we highly recommend placing a cone on your pet. Finally, we have covered post-operative instructions. Just a reminder that this is not for every surgery. These instructions are directed towards spay, neuters, and dentals. If your pet has gone to any other clinic and has gotten surgery, make sure you ask them to go over the post-op instructions. I want to thank everyone who has listened on YouTube, and make sure you follow us on all our social medias. I hope to see you all in clinic soon. Bye, everyone.